Okay, so we're going to go ahead and get started. It sounds like you guys are able to hear us. We had some people responding back to that, so we appreciate it. We are really happy that you have joined us today for our Haven't Clicked Submit webinar. So my guess is a lot of you that are attending today have maybe started the SOPHAS application but have not finished it or kind of like in between stages. So we just wanted to take a minute to be able to talk with you and help answer any questions you may have, talk about the programs and application process and some funding and things like that, and just kind of try to be here as a resource for you. So my name is Emily Lakemaker. I'm the Associate Director of Recruitment and Student Life here at the Rollins School of Public Health, and I'm joined with the current students.
Hi everyone, my name is Emily Gordon. I'm a second year in the Global Health Department.
And so the two of us today are just going to be going through this, and it's going to be relatively informal. You should see at the top right-hand corner of your screen a section where you can type in questions. Feel free to type in questions at any point during the program, and we'll go through and read them aloud after we go through this presentation and answer as many as we can get through here in this hour. So hopefully we can get to everyone's questions, and you can also email me directly, and I'll have my email address at the end of the program too. So you can see our agenda here today, what we're going to kind of be covering. We'll talk a little bit about our different departments, what an incoming class looks like. We'll touch a little on the admissions requirements. My guess is most of you are probably relatively familiar with that if you've already started the SOPHAS application. A big part of what I really want to talk about today are funding opportunities. And we'll talk a little bit about student life and then open it up to Q&A. So to get started, and then I really don't want to read all of this to you because I'm sure you guys can all read this, but if you started the SOPHAS application, you're probably familiar with our departments. And so you know that when you apply, you'll have to apply directly to one of our departments. So you can kind of think of it like a major in undergrad. And you actually have the opportunity to apply to up to 3 different departments within Emory's public health program. And the way that will work is when you go through SOPHAS, you'll pick your number 1 choice. So whatever that may be out of these 7 different departments, that's what you would apply to via SOPHAS. Then once we receive your application here in-house, we'll send you an email with instructions on how to submit your second and third choices to us. And you will be reviewed by your first choice department first. If they deny or waitlist you, then it will go on to your second and third choices. So you can see here all the different areas of study that we have to offer. So hopefully those of you that are already in this process kind of have a general idea of what you're looking at. But we do have extensive information about all these different departments on our website. Additionally, if you'd like to speak maybe directly to a student in any one of these departments, we can easily put you in contact with one of our student ambassadors to kind of help get a better idea of what global health means or what environmental health means. So just to give you an idea of what an incoming student looks like, this is a kind of a snapshot of our incoming class that just started this past fall. We brought in about 530 students. Average age was 27. We have about 40% of our students come in straight out of undergrad, and about 60% are coming in with work experience. So it's a pretty good mix. We don't have a set work experience requirement, and I think each different group brings something unique into the classroom when you're talking discussions and different contributions that they can bring. GRE scores are required. You can see here our average scores for admitted students is a 157 on both the quantitative and qualitative sections, and about a 4 or 4.1 on the analytical writing. For average GPA, those coming in with undergraduate degree, it's a 3.5, and with students who are coming in with completed graduate work in other fields, it's a 3.65. We've got a pretty diverse student body here. We've got students from 40 states and 27 countries. You can see our gender makeup there, and that's pretty par for the course for most schools of public health. It is a relatively female-dominated field, and so I don't think you're going to see many different stats, stats looking too terribly different from other schools. About 16% of our students are international, and we have about 37% that are self-reporting and self-identifying as minority students. So just to give you an idea on what is required in order to apply, first and foremost, you need to be very familiar with SOPHAS. We've got, when we kind of talked about how to rank your 3 programs and that you're eligible to apply to up to 3, you'll have to complete everything through SOPHAS. Nothing will be sent directly to us. You'll have to have transcripts from every institution you've attended. Again, we don't have a minimum GPA requirement, but you know, a 3.0 and higher is generally kind of the standard, and something to think about and keep in mind with that. You can submit up to 3 letters of recommendation. 2 is the minimum requirement, but you can submit up to 3. And the thing to keep in mind is SOPHAS won't hold your application if you've put in for 3 recommenders to write a letter for you, and SOPHAS has 2 of them, it won't hold your application. It'll go ahead and send it on, and then once that 3rd letter comes in, they'll pass that along to the institution. So if you just have a letter writer that's taking some time, taking a little bit longer than you'd like, don't stress out about that it won't hold it up entirely. Standardized test scores, so like GRE, things like that, we do have a couple of exemptions. If you're applying to our executive MPH, 2 of the 3 tracks do not require standardized test scores, the prevention science and applied public health informatics. If you're applying to our behavioral science health education program, BSHE as we call it, if you already have a completed master's degree, you don't have to submit standardized test scores. And with any of our programs, if you already have a doctorate or an MD earned in the United States, you do not have to submit standardized test scores. Otherwise, GRE is the most common one, and scores cannot be older than 5 years old. We do take, some of our departments will accept MCAT or GMAT as well. So those are things to keep in mind. You'll have to submit a personal statement. This is really just your time to talk about why public health, how you want to contribute to the field, what your personal goals are. Those are all things that you want to cover in that. You know, public health is still a relatively unique field for people to want to go into, so this is your chance to tell us why this is something that's you feel is calling you. And then, you know, anything, even if it's not public health related, any research, work, volunteer, honors, anything like that, you just really want to give a very comprehensive view of yourself. You know, it's a very holistic approach. The admissions committee isn't only looking at GPA and GRE, they're really looking at everything. So if you've got anything that you feel, you know, adds to your competitiveness as an applicant, be sure that it's included in there. And then international applicants always have to have a few extra steps, including TOEFL scores. If you have attended schools outside of the U.S., those transcripts must be evaluated by WES, which is World Education Service, and you must provide a financial certificate showing funding for at least 1 year of study. So Emily, as a current student, do you have anything that you want to, like, that you felt was important when you were applying, or any tips of advice, anything that you did while you were putting your application together?
Probably for me, because I started the application process probably around this time, which I don't know if you guys have started or if you are doing it right now, but I would say as far as like when you're reaching out for letters of recommendation, definitely give them a few weeks to prepare whoever you're reaching out to, whether it be old professors or people that you currently work with now. And don't be afraid kind of to follow up with them, just because if you have a personal deadline of really wanting to get this application in by the beginning of March or the end of February, definitely make that known to them. And don't be afraid to ask them a few times, just because they did say that they would do it, and they wouldn't say yes if they like didn't really want to write it for you. And it is better to have your application in earlier rather than later.
Yes. And on that note, we did have our priority deadline of January 5th, and that was to be considered for our merit-based scholarships, but we continue to accept applications well after that deadline. We're still accepting applications now, and that's a really good segue into our funding opportunities. So I think students tend to think, oh, I didn't meet the merit-based deadline, so there's no chance I'm getting any money, so I'm not going to apply. But that's certainly not the case. So this is a big part of what we wanted to focus on today, our funding opportunities outside of Merit Awards. And so we'll talk a little bit about these and try to go into as much detail as possible. But again, if you have any questions, just type them in the upper right-hand corner, and we'll address them after we get through the entire presentation. So first and foremost, I want to talk about REAL, which is Rollins Earn and Learn. And that's a really unique program that we created a few years back after the federal, after it was determined that public health field would no longer be eligible for the federal work study money. And so we basically created our own work study program. And it's where if you are awarded this as part of your financial aid package, then you're eligible to apply for our REAL jobs, the Rollins Earn and Learn jobs. And those are agencies that we've partnered with across the city of Atlanta, everything from positions here at Emory, within the School of Public Health or across the university, at the CDC, at the American Cancer Society, the Carter Institute, several small, just public health agencies and nonprofits that do various work here, whether that's working with community gardens to fight food deserts, or working with AIDS, HIV education, or working in maternal and child health. There's a lot of different agencies that we've partnered with. We have about 400 students in the REAL program right now that are doing this. And so if you are awarded the job, this is part of your financial aid package, you can apply for those REAL jobs. And it's not a placement, so you still have to apply and interview and get them, but I think that's beneficial, and then it's helping you prep for when you have to apply for REAL jobs.
REAL jobs
outside.
after you graduate.
Yes. I guess we had to make it confusing in that sense. But you do get to earn up to $2,000 a semester or $4,000 in a year. And students are usually working in the 10 to 20 hour range a week. Obviously school is first and foremost, but so this isn't a full-time opportunity, but these are actual real public health jobs. You're not making coffee, you're not getting copies, you're doing legitimate public health work. And so in order to be able to be eligible for this, you have to fill out your FAFSA. The sooner you fill out FAFSA, the better, as REAL is more first come, first serve than need-based. So get that FAFSA filled out, and the sooner you do it, the better. International students are actually eligible for REAL. You guys can apply for this program in your once you're here in your first semester. You'll apply internally through a form that we have, and you would be notified of your award that would start then in your second semester. So that's first and foremost, I think, one of our most exciting opportunities. And then moving on down, you can see we have a lot of awards tied to various Service Corps organizations. So if you are a returned Peace Corps volunteer, you automatically, and you're admitted into the program, you automatically get a $10,000 tuition award. So it's a one-time $10,000 tuition award for anybody that has completed their Peace Corps service. We have about 80 returned Peace Corps volunteers in our program right now between our first and second years. AmeriCorps, we do and in fact, actually, I literally just got out of a scholarship meeting right before I came in to do this, and I was just told that the AmeriCorps matching scholarship is now $6,000 and not $5,000 like it shows there. So this is to match with the Siegel Award. So between the matching award with Siegel and our $6,000, you're getting between $11,000 and $12,000 as a AmeriCorps alumni if you've completed that service. Teach for AmeriCorps, we give $5,000. And we have a Masters International Award. So what this is students that are going through our Peace Corps, through our master's program, and that are in our MI program. That means they're in the process of applying to the Peace Corps to go to be placed very quickly after graduation. So you complete your degree here, but during the time that you're here as a student, you're doing your Peace Corps application, and you're also attending weekly seminars that are led by returned Peace Corps volunteers to help you basically learn and develop skills that you would need once you're placed in country. And if you get your Peace Corps, if you're accepted into the Peace Corps, at the end of your second semester of your second year, you're given a $2,500 scholarship to help kind of make that transition into your Peace Corps service. So those are some of those awards that kind of focus around the service area. For any veterans that we may have that are applying, you can see here moving up to Yellow Ribbon. It's a $2,500 award. We award 2 of these each year to graduates that have served post 9/11. And the thing to keep in mind with this that I think is cool is that dependents are also eligible. So if you are a dependent of a veteran, then this is an award that you would be eligible for as well. So with Yellow Ribbon, that's an internal form that we have on our website. And so it's not necessarily tied to FAFSA. Now moving down into these need-based awards, like REAL, these are all tied to FAFSA. So again, I cannot impress upon you how important it is to get that form filled out sooner. The sooner the better. I think people tend to get confused too, especially those that may be coming straight out of undergrad. FAFSA is not tied. The way that FAFSA is reviewed for graduate students is very different than the way it's reviewed for undergrads. So even if you're still considered a dependent of your parents as a graduate student, the funding that you may be awarded is not based on your parents' income. So, people tend to think, oh, I'm not going to get any awards, but that may not be the case at all when you are thinking about it from a graduate student perspective. So don't let your undergrad experience cloud that. Really, I would take the time, fill out the FAFSA, because you never know what you may be awarded because of it. So you can see here we've got 3 need-based awards that we award. The Letty Pate Whitehead, which is awarded to Christian female students from these southern states that are listed here that demonstrate financial need. That's a $12,000 award, $12,000 award plus REAL, so meaning you would be eligible to apply for those REAL jobs that we spoke about. And then we have our Lupton Jones and Ivory Hunson awards, which range between $4,000 and $6,000. So again, you wouldn't be eligible for these unless you are filling out your FAFSA form. And again, like I mentioned, I just came from a scholarship meeting before this, so I didn't have time to update this presentation, but we just got announced the new awards that are basically RSPH tuition grants, and these are for $8,000. And again, these are tied to FAFSA. So if you fill out your FAFSA, you will be in the pool to be eligible for these $8,000 tuition awards, and that's $8,000 paid out over 2 years. All you have to do is fill out FAFSA, and from there the decisions are made. So we're pretty excited to have that to add to our comprehensive list of scholarship opportunities. So student life, we've got a really active student life here at Rollins, which I think is one of the things that makes us unique. And you can see here we've got more than 20 active student orgs. I only listed a handful just because, quite frankly, we don't have the room to list all of them. These are some of our more active ones, but it's very easy to get involved here. If you come to visit Emory, which is our admitted student event that we have in April each year, we have a student org fair, and then at New Student Orientation in August, we'll have another one. And so that's a way to get to talk with all the student clubs and hear what they're about, learn what they do, get to meet some of their leadership, and get an idea if it's something that you're interested in. Again, I would be more than happy to put you in contact with any current students to kind of learn more about what they do and how they get involved with clubs. And then once you get here, if you feel like there's something that doesn't represent you, or if you feel like there's like maybe a topic being missed in our student orgs, you can always start your own. It's a pretty easy process to do that. So getting involved is very easy, and I know students tend to worry about the time management aspect, but people make it work. I mean, most of our students, I can't think of a single student that I know that's not either working or super involved in a club or both, any of that. And the clubs do all sorts of events. We've got a monthly event called Convos on Tap, and that's put on by our Student Government Association. The first one for the semester is this coming Friday. They get a couple of kegs and have that and lots of non-alcoholic options as well. And it's basically just a time for the entire school to come together, faculty, staff, students, on a Friday afternoon to kind of hang out and have a chance to talk. Student government also puts on fall fling and second year send-off. Those each happen in the respective fall and spring semesters. And you can kind of think of those like public health prom.
Yeah.
You get dressed up and you go and just you go to a nice venue and have a fun dance. Our student clubs even put on conferences. Our reproductive rights group put on a conference last month, and it was basically viewing reproductive rights through the eyes of social justice. And then throughout the semester, the clubs will bring in speakers and guest lectures. to come in. Oftentimes those will be over the lunch hour, so it can be like a brown bag lunch, or sometimes they'll be maybe bigger and have a big program wrapped around it in the evening. Networking events frequently happen. So some of these are more social based, like just for fun, and then a lot of them can be more professional based. So it really just depends, but again, it's very easy to get involved. Do you want to, Emily, talk about some of the ways you've gotten involved in student life here?
Yes. So I was the previous global health representative for RSGA, so student government, and in our position we're kind of a liaison between the students and the faculty, and I guess some staff in the department as well, to make sure that students are getting everything out of the global health department that they want in the 2 years. If they have any questions or concerns, or if they really like one class and want it to be offered every year instead of every other year, or even every semester. And then I also was the events and outreach chair for OLA, Health Organizations for Latin America. So through that, I was able to really network and work with a lot of different community partners, whether I was bringing them onto campus for lunch and learn, or we did a book panel. Even sometimes we would go off campus and do a mixer for practicum opportunities to kind of get the first and the second years talking to each other in in fall semester, I guess. Or even doing trivia. So I think those are great opportunities to get to know your Rollins students and faculty, and also a lot of the organizations here in Atlanta. But getting involved in student life, I'd say at Emory, is just a great idea in general, because all the grad schools have fairly active student life and student org, so it's a good way to get to know the interdisciplinary aspect of public health and really work with other orgs who have similar interests. Yeah. Because you'll end up networking with them here and then outside of school, and sometimes they can help you with jobs or questions or even making an event better too.
Yeah, and we do mixers across campus. Like last semester we did a mixer with the law school and the business school. So it was public health, law, and business. And it was basically like a water park day.
They got a slip and slide.
Yeah, had a band, and so those are just fun ways to get to meet people across campus. And then there's also inter-department mixers here within Rollins. So, global health may invite biostats to have a bagel breakfast or something. So there's always something to do and ways to get involved. So you don't necessarily just have to live in your department bubble, or even
like the Rollins bubble being on the other side of campus from everything else. So.
Yeah, so it's very easy to get involved. And one thing, going back to funding opportunities really quickly, I just kind of thought about it with Emily sitting here next to me. One thing that we didn't talk about are on-campus jobs. And there's a lot of those opportunities. So Emily here is a graduate assistant here in our office as doing basically admissions and recruitment work for us, helping plan events, sitting in on webinars, things like this. But in addition to that, there's also a lot of professors will hire for research assistants, teaching assistantships. So those opportunities are there. And those do not come with a tuition stipend, but they are paid positions. So that's something to think about. Okay, so at this point, we're going to go ahead and open it up to questions. We've kind of said all we wanted to say, but we do want to open up to questions that you guys may have. I see we've already got a couple in here. And so we'll go through and read these, but please feel free to go ahead and start typing these in, and we will read them aloud and make sure we get them answered. So first up, Melissa a few minutes ago was asking to repeat our names. We're both Emily's. I'm Emily Lakemaker. I'm the Associate Director of Recruitment and Student Life here at Rollins.
And I'm Emily Gordon. I'm a second year in the Global Health Department and the Graduate Assistant in Admissions and Student Services.
Yeah. So next up, Chris is asking, how strongly is the score on the GRE Quantitative section valued? I've done well on the two other parts, but that one was below average. So great question, Chris. It really depends on the department. So quantitative, let's see, biostats, epi, GH, honestly, they're all going to take them into consideration, but, some departments are really going to put a higher value on that than others. But again, it's a very holistic approach. And I know people really tend to roll their eyes when they hear that, but it really is true. So if you feel like you do, if you have a weak showing in your GRE on that, then maybe, you've got some on your transcripts, you've got some stronger quantitative type classes that you've taken and that hopefully you did well in. So there are going to be some other ways to kind of showcase that so it's not strictly just based on GRE scores. Melissa's asking, is there a chance to apply for merit-based scholarships once you are a student? So Melissa, we only do merit-based scholarship review once, and that's in that by that priority deadline of January 5th. So if your completed SOPHAS application got into our office by January 5th, you'll be automatically considered for our merit-based scholarships. After that, it's the scholarships. There's still plenty of other funding opportunities, like we just discussed, all the ones that were in these previous slides. But you wouldn't be re-reviewed. Mm-hmm. So unfortunately, that's not the way that we do that particular process.
I also wouldn't be discouraged if you missed the merit-based deadline, just because like I said before, I applied later and I came into the fall semester not having real or any of the scholarships, and I obviously made it work and am here in a second year. And you also have the opportunity, if you don't get real in your first year, you will be re-eligible for it in your second year as long as you turn in the FAFSA form by March 15th. So it is like very daunting thinking about applying for grad school, but the merit-based scholarships are not the only way that you can pay.
Okay, so Kelly is asking, how easy is it to change programs once I am admitted and have started? Well, it's not impossible, so we'll say that, but it's not necessarily recommended. And so the reason I say that is that basically when you are, like we were mentioning, when you apply, you're applying directly to the department. So Kelly, let's say you're thinking about global health. So all of your application materials will be reviewed by global health. If they say yes, you're in the program, great, that's it. Mm-hmm. So then when you get here, it makes it a little bit difficult if you then say wanted to change to BSHE, Behavioral Science Health Education, because they haven't reviewed your materials and they've already brought in their class of students. They've already brought in their class. So it's not impossible, it does happen. It's not necessarily an easy process. And so we really try to encourage students to do as much research as possible on the different departments to try to get an idea of what the best fit for them is. So again, if you want to talk to somebody in one of the departments, if you want to talk to advisors, I can easily make that happen for you. And also, I think a great place to start is to look at the course catalog that's on our website, as that lists all the different classes within each department. And that's a good place to just kind of start reading about those classes and see, is this something that I want to study? Mm-hmm. So, all right, so Nala's got a couple of questions here. The GRE codes for MPH program, I honestly don't know those GRE codes off the top of my head. I am trying to find them right now on our website on my phone, but they are directly on our website. Let's see if I can find them here. I think I'm in the general area. Maybe not. I know they're on our admissions page and all. I'm just not too sure. I'm not able to find them on my phone because it's set up a little bit differently. But I can easily find that out for you and shoot you an email with that. And your next question is about FAFSA form. Really, that should be filled out as soon as possible. So FAFSA is up. It's up and open. So the sooner you get that filled out, the better. Certainly by March would be, but the sooner you get it filled out, then you know it's off of your plate and you don't have to worry about it anymore.
Yeah. If I remember correctly, it gives you an option to fill in all your information from last year in case you haven't done your taxes for this year yet. But if you do that option of filling it in from last year, you can eventually update it, but it'll also send that to us and then send the updated form to us too, and that counts as completing it.
Mm-hmm. Let's see. Kelly is asking, can you explain the difference between global MPH and MSPH? Sure. So the main difference really, Kelly, is that is research, I would say. Mm-hmm. The MPH is more designed to be a terminal degree, meaning students would enter the workforce, are looking to enter the workforce immediately upon graduation, whereas the MSPH is a great track for students that are thinking they may want to stay in academia and go on to pursue a PhD. And it's not to say that doing one or the other, like if you did an MPH, that doesn't mean you could never go on and do a PhD. And if you do an MSPH, that doesn't mean that you can't go on and do, enter the workforce. It's not required of either one. But the MSPH just is a bit more designed to prep students for that PhD track. So that seems to be all of the questions as of right now. I'm not seeing any more come in. But we do really appreciate you guys attending this. Hopefully it helped kind of answering your questions. You can see my email address here. So if you think of anything else, or just had anything very specific that you wanted to talk about, please feel free to reach out. We can certainly do that. Oh, it looks like we got another one. So Kelly's asking writing samples. So you don't have to submit a writing sample. The only writing sample that's required, I guess, would be the personal statement. So, as part of the main application, you don't have to worry about that. It's not one of our requirements. Okay, so yes, questions are keeping coming in. It's listed as optional, but it's not something that's required, and most of our students, I don't even think. So Kelly's asking again about the optional, about the option of the health app, of the writing sample.
Yeah, it's definitely not required. I didn't submit it to get accepted into the Global Health Department. Yeah. And also, so if you're asking about the community health and development concentration within the department, you don't have to do anything for those either. So on your application, you'll obviously list whatever concentration you're interested in. However, all first year students, they have seminars on all of the concentrations in that August, September, and then you don't have to declare until October. There are a few students who will declare one concentration in October to their ADAPS and then change throughout the rest of the year. So it's really just, I wouldn't worry about picking your number one concentration just yet.
Yeah, you don't have to worry
about that. So you don't have to worry about that.
And Sanal, I don't know if you're still on the webinar, but the GRE code is, to submit it to Rollins, is 4223. That's the institution code. And then we've got a question here directly for our student, Emily, and asking about experience in the Global Health Department, and asking about certificates and what she would like to do in the public health field.
Okay. Well, my concentration in global health is public nutrition. So within our department, you can kind of go two ways. You can do a lot of malnutrition work or maternal and child health, or you can focus on non-communicable diseases and diabetes and obesity, and that's kind of where I'm focusing a lot of my coursework. So we have a global diabetes as a model for surveillance class, so I'm in that now. We have a translation and implementation science class that I've taken, so Venkat Narayan and Mo Ali are great professors to look to if you're interested in that. And I really like being in the Global Health Department because I'm learning a lot of skills, but I'm also getting a lot of firsthand experience from professors who have worked in, I would say, like 10 to 12 different countries and what they're doing now, and how each of those different experiences are tying into the work that they're doing now. And then as far as a certificate, I'm also enrolled in the Socio-Contextual Determinants of Health certificate, which I tend to take more BSHE classes for that, but a few of the electives are global health based. So health as a social justice and health as a human right are two classes that you could take as electives for that certificate, but are taught and housed through the Global Health Department. And as far as what I would like to do in the public health field, I would prefer to focus more on communications for an organization or stakeholder development, really working for an organization that does domestic and international global work, because a lot of people come in thinking that global health can only happen outside of the United States, but it can happen here too, especially because Atlanta is a very diverse area, and is home to one of the largest refugee populations as well. So you get to see a lot being in Atlanta than some people do when they go abroad.
Yeah, and talking about refugee populations, there's a town just just east of where we are here in Emory, maybe about 10 minutes away, called Clarkston. And it's a kind of a official government-sanctioned refugee settlement city. And it's often referred to as the most diverse mile in the world. People from all over the world are being resettled there. And we have a lot of our students, especially within our RPCV, Return Peace Corps volunteer community, that do a lot of work there in Clarkston, whether that's helping with tutoring with kids as they're trying to get, develop their English skills and get settled in school, working with the parents and adults of just the steps they need to take to, get acclimated here, learning how to drive, learning how to navigate American bureaucracy.
Go to the grocery store.
Yeah, go to the grocery store. Working with people working with people in the community gardens. So there's a lot of different ways to get involved. We call it community engagement, and community engagement is a huge part of our mission. All right, so Kelly's got another question. How long do practicum placements last? How much control would someone have over where they get placed if they're in global health, and if they are in global health concentration, want to work abroad? So practicum it's 200 to 400 hours that you have to complete, and you can begin working towards those hours after you've completed your first semester. So anything that you do during your first semester would not be counted as your practicum hours. There's no real placements, Kelly, so the way you basically have to kind of find your practicum, but we do provide a lot of resources to help students in that, whether that's through the Career Center, through your department, through clubs like Emily was talking about, where they maybe have like a little mini practicum mixer where you can talk to second years. We have a fair every November. So there's a lot of different ways to find those opportunities. If it's, you can go in and look at what students have done in the past and reach out to those organizations to see if they have work that needs to be done, still if they're still hiring, or if you find your own organization and your own opportunity that's never been done before for a practicum, you just have to go through the approval process, because there are certain learning outcomes that have to be met. And so, it is a matter of getting it approved, but you really get to pick where you do it and where you go. If you want to go abroad, you can go abroad. Global health students go abroad. Any of our students can go abroad. I don't know. I don't have exact numbers off the top of my head.
So I don't have the numbers either, but if you go onto the Rollins website, there should be, it might be under the Global Health Department. If you can't find it, you can look for it in the search bar, but it's called the SFE Report. So the Summer Field Experience Report, and they do one every year, and this includes all global health or all global environmental health, global EPI, anyone who received global field experience funding to help fund their practicum abroad. So it surveys all of those students to see how many went abroad, how many received funding, how many got paid if they didn't receive funding, where they went, what they were doing, whether it be qualitative or quantitative research, or even working in an office. So those,
maybe even pull that up.
Oh yeah. So that will give you more concrete numbers of how many people went abroad or how long they were abroad for.
Let's see if we can pull this up real quick. So bear with us, because I think it's a really good site, and it's a lot of different. Let's see. We'll just search for Jiffy maybe.
So yeah, Jiffy might have a report, but Roger Roche does it, and it's the SFE.
So past global field experiences. So here you can kind of get an idea. I think this is what we were talking about. So we just searched for GFE, which is global field experience, on the Rollins website, and you can go through this and see what they did, what department they were in, where they went, and just get an idea of where our students are going. So I think this could be a really good tool. Okay, Sylvie is asking, what are the job opportunities you have after your MPH? So that's a great question, and since we're right here on the on our website, one of my favorite resources to direct students to is under our careers page. If you go to graduate employment status, This is 5 years worth of employment data. So we survey our students a year after they graduate. And we have about a 98% response rate on these. So we drill it down pretty well as to where our students are going after graduation. And so you can then look by department. So let's just pull up, for example, the 2014 report from from behavioral science. So it gives you, so this one we had a 99% response rate from all the students that graduated. And it breaks it down if they're continuing education, if they're still seeking work, if they're employed, it breaks it down by that. And then this is the most broad form of it, like if they're in public health, like where they're actually working, whether that's like, you can see 38% are in government, state, we've got 17% that are still in academia. And then you've got some time frame of how long it took them to get their placement, but salary information, which I think is important. You've got a salary range. And the thing to keep in mind with salary range is that this is students who have been interviewed, who are surveyed a year out. So don't see this and think, oh, that's all I'm going to make, because, again, it's a year out. And I'm sure some people see this 18% down here of, less than 20,000. Again, that could be Peace Corps. A lot of our students who enter Peace Corps or some type of service corps immediately upon graduation. So, you can see here our biggest majority are in between the 40 and 59.9 category. And again, this is only a year out. And then we kind of have it broken down by geographic region as to where they're going, and then that's also broken down by salary. But my favorite part of this is this kind of last section, and it gives the organization and their job title. So you can see where all students, within this department, where they're working and what they're doing. So I think this is the best resource for students to go through, especially as you're trying to figure out maybe what department you want to apply to get an idea, because that's going to tell you exactly where they are and what they're doing. All right, let me find this again. Okay, so we got these, got that. And Kelly's asking, how often do students get work or practicum opportunities at the Carter Center? I don't know exact data, but it's a very common place for our students to work. We have real opportunities there. We have students who are doing internships or practicums there, students that are working there over the summer. So it's just down the street from the school, and we have a great relationship with them. So in fact, my graduate student that worked for me before Emily, when she graduated from the program, she went and worked for the Carter Center for several months doing guinea worm eradication in Chad. So she went over to Africa for several months to work on that through the Carter Center. So we have a great connection with them. All right, next question, is the career office able to facilitate current students to contact alum who are working where they may want to be looking for employment? Absolutely, that's a big part of what they do. We actually have the largest staffed career services office of any school of public health in the nation. So we put a lot of resources into that. We have a mentorship program that you can sign up for to get attached to, to get connected with the current alumni. If you've got a set, company or organization in mind that you want to work for, the Career Services Office can kind of help put you in contact with someone that's working there, just to maybe have an opportunity to do an informational interview, or even just talking via email. Kelly's asking what kind of relationships a student have with advisors. And do you want to take that one as a current student?
Yeah, so you'll get an ADAP, which is the Associate Director of Academic Programming. So each department has one or two, so you'll kind of be paired up with them. And then each student will also get a faculty advisor. And it's really up to you, like what kind of contact you want with them. Obviously, they all have the idea in mind that they're supposed to answer the students' questions, help them if they are looking for a thesis opportunity or practicum opportunity, and they kind of are unsure of where to start. But I have some friends who meet with their advisors every other week. I have some friends who have met with their advisor once. It's really up to you whether or not you want that to be your primary relationship here at Rollins, because you also have the opportunity to reach out to all of the faculty within your department and within the school as a whole. So you can kind of seek out your own interests and relationships if you aren't necessarily paired with the number one advisor you wanted to be paired with. I meet with my advisor maybe like once a semester, and we still have a great relationship.
All right, Chris is asking, if I have a public health project I've been working on prior to admission but hope to continue throughout and after grad school, can the career development mentorship program help me develop it or pair me with a faculty member who would be able to provide guidance, networking, etc.? Yeah, I mean, that could be something you wouldn't even necessarily have to go through the Career Center for that. That's something that you could work with your ADAP, like Emily was just talking about. So your ADAP kind of functions as the same way as your academic advisor in undergrad. They're a staff member here. So your ADAP would be a great resource for that, as well as, you know, your faculty member that you get paired up with. Career Services could certainly help in maybe finding alumni that are doing similar work. So absolutely, that's definitely something you could take into consideration.
You can also, can we scroll up to the faculty? Because you can go on the Rollins faculty page and search by interest. So look at all of the faculty and not just your department. And
so you can, over here on this side, you can do a search by, filter by department, areas of interest, things like that. So with our area of interest, you can see how substantial that is, and you can filter down our faculty from that. Okay. All right. Oh, here they keep coming. I love it. I love it. Chris is asking, is it too early? No, I don't think it's too early to begin contacting faculty. You know, you can just let them know that you've applied and you're, you know, obviously you're awaiting your decision, but that your, you know, your research interests certainly match up with theirs, and you would look forward to the opportunity to working with them, you know, if accepted and if you're here in the fall. So absolutely, it can't hurt. Okay. I don't want to prematurely end this, but looks like they are starting to questions are starting to wind down a little bit. So again, let's pull this up. So you've got my contact information there. If you need it, or if you have any other questions or anything, just feel free to reach out. We're more than happy to help and answer any questions that you may have. So with that, I think we're going to wrap it up. Thank you so much for joining us today. We have been recording this, so we'll post it on our YouTube channel, and send, when this gets live or when this is posted, we will send out an email to everybody that attended this, so that way you can go back if you want to go back and rewatch or re-listen or you know, look at that funding slide again or something like that. Then you'll certainly have that option. So thank you so much for joining us, and I hope everyone has a great rest of the week.